Hi, my name is Dr. Emma. I'm a dermatology doctor and I'm also the co-founder of the House of Medics. And today I've been asked to do a video about skin care and skin protection myths. So things to do with the skin basically. I'm going to debunk a few myths, so follow me, let's get straight into it. All right, the first myth is that you only need to wear sunscreen when you're outside and it's sunny. I hope that most of you guys know it's not true, but I will explain why. So, of course, we worry about skin cancer. You know, one of the main reasons we wear sunscreen is to protect our skin from UV rays that lead to skin cancer. So for that reason, we always recommend that you wear SPF 30 or 50, you stay out of the sun, you stay in the shade when it's sunny, you wear a hat, etc., etc. However, UV rays are responsible for lots of other things, and it's not really just that simple. So of course, we know that UVB rays are the ones that contribute to skin cancer, and that, you know, you are much more likely to increase your risk of skin cancer if you're out when it's very sunny and it's a clear day and you're in direct view of the sun. However, you also have UVA rays, which are responsible for aging, and UVA rays can travel through windows. So we've all seen that picture of the truck driver who used to drive several hours a day and he never wore sunscreen, so that we can see from the picture that as the UV rays were coming in through the glass, one side of his face was extremely wrinkled and the other side was much less wrinkled. So he would probably say, but I'm never outside though. That's because UVA rays can travel through glass and cause those visible signs of aging. The other reason you should wear sunscreen, not just when it's sunny and when you're outside, is because a lot of us, me included, are trying to combat hyperpigmentation, dark marks, dark spots. And again, we know that even just the light that we use to see, so visible light, and also the blue light that comes from screens, so that's, you know, our laptop screens, TV screens, mobile phone screens, these can actually contribute to hyperpigmentation. So you definitely need to wear sunscreen if you're trying to combat pigmentation, even when you're not outside, because the light that you use just to see what you're doing can theoretically contribute to the hyperpigmentation. Another thing that a lot of people don't know is that on the sunscreen bottle, there are actually two things that determine the efficacy of the sunscreen. So you've got SPF, which I've mentioned, which tackles UVB rays that contribute to skin cancer. But you've also got the star rating, and that's how much protection the sunscreen provides against UVA. And a lot of people don't know that. So the recommendation from the NHS is that you always use an SPF 30 or above, but also a sunscreen that has at least a 4-star UVA rating. So it's really important to look for both so that you're getting the maximum use of your sunscreen. Okay, the next myth I'm going to tackle, which can be controversial. I hope people don't start attacking me in the comments, but it's all about topical steroids and the fact that people think they're evil. It's all over social media that topical steroids are the devil and doctors only prescribe it because we're evil. That's definitely not the case. So unfortunately, like most of the medications we have, every prescribed drug has side effects, and topical steroids are no exception to that. Some side effects you may hear people talking about are thinning of the skin, redness of the skin. Sometimes you can get acne from applying topical steroids to the face. But actually, we really only see these side effects if you're using topical steroids continuously for a long period of time. But of course, this differs depending on the strength of the topical steroid, the part of your body you're applying the topical steroid, and for how long you're using them. So really, topical steroids are still the mainstay of treatment for many inflammatory skin conditions like eczema, psoriasis, and so many others. And they've really changed the way that we practice in dermatology. I say we, of course, they've existed much longer than I've been doing dermatology, but you know, for a dermatologist, topical steroids is an excellent treatment for so many conditions. And if they're used as prescribed under the care of a doctor, a GP, or a dermatologist, or any other doctor who knows what they're doing, you know, they are really safe. One paper that I read said that, you know, you're only really going to get systemic absorption from steroids if you're using about 500 grams of a weekly potent steroid. So that's your hydrocortisone, which you can buy over the counter. So more than 500 grams on your body per month for a long period of time. So I've got a standard tube of, it's not steroid cream, but just bear with me. This is a 20-gram tube. So 500 grams would be the equivalent of 25 of these used per month. Of course, as long as it's weak potency. Of course, if you increase the potency of the steroid, you increase the likelihood of the side effects, and you decrease the amount you would need to use before you start to see side effects. But just to illustrate that, you know, a lot of the weak potency steroids are very safe, and we use them in children, and the majority of people won't get side effects from them. Saying that, the side effects do exist, and some of them can potentially be serious. So you always want to be checking in with your doctor or dermatologist about how you're using your steroid creams. Make sure you're not using them too much. Make sure you're using them as advised, and that you're definitely giving yourself breaks. You know, you definitely cannot use topical steroids every day for months and months. So you should definitely have breaks. And when your skin condition gets better, you should think about reducing the frequency or reducing the potency of the topical steroid that you're on. Okay, another myth that I'm common for is that you don't need to moisturize your skin if you have oily skin. And to be honest, I used to be of that school of thought way before I knew what I now know about this skin. And I understand why people think that. It seems counterproductive, right? Your skin is already oily. Why are you going to put more cream on top, which will make it more oily? The reason is because oily skin does not equal hydrated skin, right? So oil is sebum. Our skin produces sebum to act as a lubricant, and it has very useful effects on the skin. However, that doesn't necessarily mean that your skin is moisturized, because moisture has a lot to do with water content. So a high water content does not, So a high oil content does not mean that you necessarily have a high water content, does not mean that your skin is moisturized. So often a lot of people will think, my skin is already oily, I'm not putting any cream on, but actually your skin is actually begging for water, begging for hydration. And if you continue to refuse to provide that hydration to the skin, you might actually find that your skin becomes more oily because your oiled glands go into overdrive to combat the dryness. So if you do have oily skin, I recommend that you find a light moisturizer, and you can get moisturizers that are specifically made for oily skin. You know, they have mattifying effects, or they specifically make them to not contain additional oils. There are definitely moisturizers that exist for people with oily skin, and to be honest, you may notice that your skin, the texture of your skin, the oiliness of your skin improves if you start moisturizing, because that's certainly what happened with me. So definitely, if you do have oily skin, does not mean you should not moisturize. It probably means that your skin still needs some water, and that can be provided through moisturizers that have things like ceramides and hyaluronic acid in them. Another myth that I want to bust, and one that actually breaks my heart, is that people think that acne is caused by dirty skin. And the reason I say it breaks my heart is because I see people coming into clinic and they say, I wash my face 3, 4, 5 times a day. I don't understand why I have acne. And I have to say, the fact that you have acne has nothing to do with the fact that your skin is dirty. So please don't feel like you need to wash your face multiple times a day. And actually, you might be causing damage to your skin, because as you continue to wash your face, all that harshness, the dryness that ensues from the continual washing of your face can lead to inflammation, which of course will drive the acne. So I know it's sort of, you would think that it's dirt that then clogs the pores and that causes the spots to arise, but that's not the case. Acne is a medical condition. I'm always saying this, it's a medical condition, and some people do require medical treatments. It's a state of inflammation. So purely just trying to keep the skin clean, although it is important, is not going to be able to tackle the inflammation at the source. So if you do have severe acne, see a GP, and if you're in the UK, if your GP feels that you need to see a dermatologist, you will be referred to one, and there are lots of treatments that are available to you. Saying that, of course, you do need to keep your skin clean, because if your skin is dirty, it will increase the likelihood of you getting spots. I'm trying to say it's not the root cause of the problem, but a dirty face will, exacerbate the risks. of you developing breakouts. So it's really important to cleanse twice a day. Use a gentle cleanser. You don't need to scrub your face. You don't need to be abrasive. You just need to make sure that you're taking off, especially at the end of the day, you're taking off makeup, grime, dirt, sunscreen that's been sitting on your face all day. Make sure you wash it off before you sleep. Another thing is make sure you're changing your pillowcases, because you know, often we can put a lot of effort into washing our face, but then we go and put our face back on a dirty pillowcase. Or if you're someone that puts a lot of product in your hair, you're then rubbing your face with all that product. And you know, if you're a black woman like me, or a black man even, you know, those products are probably quite greasy and occlusive, and then you're literally just rubbing your face in all the oil, and that's transferring onto your face. So really, really important to change your pillowcase regularly. Make sure your pillowcase is not dirty. That will reduce the likelihood of you breaking out, but the dirt is not the root cause of the acne. If you have severe acne, see a doctor. We can help. If you don't have severe acne, you've got mild acne, there are lots of over-the-counter products that can be helpful. So many ingredients that can help: salicylic acid, azelaic acid, cleansers, so many different things. Benzoyl peroxide, you can get over the counter without a prescription. So there are lots of things available to you. Maybe I should do another video about that. Comment below if you want me to do another video about over-the-counter products for acne. And the last myth that I'm going to debunk is all about natural products for this skin. This is one of my pet peeves, because I don't know how we've got to this stage. There's been some clever marketing, probably from a few brands over the years, that's basically told us that natural products are best. And when I say natural, people mean, I mean people referring to things that are based from plants, or you know, to be honest, it can be anything. As long as they write natural on the front, people seem to buy it and they seem to fall for the trick. Now, the thing I always say is that natural is not always best, especially if you have sensitive skin. A lot of the cases of contact dermatitis we see, so that's people that have sort of itchy, irritated skin because they're allergic to a product. A lot of it is because the product is natural or has natural fragrance in it. Just because it's natural, that doesn't mean it's going to agree with your skin. And the thing I say is that someone has actually used their brain, used their expertise, the science, all the knowledge that they have, to go to a lab and create something that is safe for the skin and hypoallergenic. Just because that's not natural, in the sense that it wasn't taken from the earth or taken from a plant, that doesn't mean that it's worse, because it shouldn't be worse. That person has actually invested their scientific knowledge to create something that's ideal for the skin. The example I always use is that poison ivy is a very natural product. You know, it's not created in the lab, it grows from plants, but that doesn't mean that you can get away with eating it or rubbing your body in it. It's very toxic. That's always the example I give. So just because something is marketed as natural doesn't mean it's better for you, especially if you're someone with sensitive skin. So all these like lavender based products and products with all these strong fragrances, they'll tell you, yeah, it's natural fragrance, but actually I see a lot of cases of contact dermatitis, and I really have to break it down and say, look, this thing that says hypoallergenic on it was specifically created for people like you. Whereas this thing that you seem to love because it's natural is just growing out of the earth and doesn't have any, you know, doesn't have any demands, or no one's placed the demand on it to be good for your skin. It's just doing its thing. It's growing from the earth. So it doesn't necessarily have to be good for you. It's a natural product. Whereas that thing that was made in the lab has to be good for you because that's the mandate that was given to it. So please, please, please don't fall for the hype that all natural products are better. If you're someone that doesn't have sensitive skin and you know your skin is quite forgiving, of course, by all means, if those products work for you, that's fine. But if you know you've got eczema prone skin, allergy prone skin, please do not just fall for the hype that natural is always better, because often it's not. Okay, so I've debunked 5 myths about the skin. I hope you found them informative. If there are any other myths you want me to debunk or anything specific you want me to talk about on a video, please comment below. I'll make sure I do that for you. Thank you for watching. Don't forget to subscribe to the channel and keep up with what we're up to at the House of Medics.